Welcome everybody, I'm Setareh Fatemi, I'm here with Valeria Monti, and our guest today is Amanda Schwint. We would like to ask her about some veterinary BNCT studies that she's conducting. Welcome Amanda. Could you give us a brief introduction of yourself?
Thank you for the invitation. It's a privilege to be here with you. Well, my name is Mandy, and I'm a biologist by formation. I work at the National Atomic Energy Commission, and I'm a principal investigator at the National Research Council of Argentina. Probably the most important part of my life is not in my CV. I have, thank God, a wonderful family. And I love what I do, and I'm very fortunate to have a wonderful team and to get up every morning wanting to go to work or stay at home and work remotely now. But if I had to choose again, I'd choose the same. I'm 63, sorry. And well, I feel very fortunate to be part of a team and be able to contribute to BNCT whatever I can.
So we know that you've been involved in some veterinary studies, which I think is a very interesting subject and maybe not so common in our research field. So how did this research start for you?
We had been working for several years on the hamster cheek pouch oral cancer model, attempting to optimize BNCT for that pathology, for head and neck cancer, basically, when head and neck cancer was a new target for BNCT back in 1998, a long time ago. We set up a collaboration with vets to treat terminal cats with squamous cell carcinoma. And what was very interesting for us was the fact that this pathology in cats is of the same type we were inducing experimentally in our hamsters. So it was an excellent way of moving from translational research to actual clinical veterinary application. We were able to treat 6 cats with encouraging results, and then we ran out of money. And more recently, we were able to start treating dogs with also terminal dogs with head and neck cancer. And in that sense, we aimed to contribute both to establish a role for BNCT in veterinary medicine, and also prepare the way for clinical BNCT studies in humans at the National Atomic Energy Commission of Argentina. We were able to treat 5 dogs, and well, I had a grant, and the National Atomic Energy Commission also provided some funds in terms of some trips to Bariloche, to the reactor, and reactor time. But, well, the grant finished and we were not able to continue. But we did treat 5 dogs with encouraging results. And it also showed us that it would be convenient to modify our epithermal beam in the RA6 reactor in Bariloche to make it more penetrating, to improve the dosimetry of these very large, deep-seated tumors.
What are the challenges of veterinary patients?
If we think of patients in terms of not a research project, we have the problem that equipment is scarcely available to treat or study animals. at least in Argentina, it's very difficult to have access to equipment that is usually used by humans. Costs are not really affordable by pet owners. In terms of advantages, I would say that there are a few established treatments for pets. And so in that sense, BNCT is a more welcome alternative. For humans, there's a wide array of treatment options that are not available to pets. And in terms of the actual treatment, there is a very practical problem with pets, and that is that you need sometimes long anesthesias to be able to treat them. For example, at a reactor, a patient can just sit positioned correctly and just stay there. Whereas with a dog, perhaps a dog that is not in good clinical condition, you have to anesthetize them for 2.5 hours. If you're using more than one portal, you have to reposition in between portals. And well, that does imply a complication.
Could you tell us about a vet patient or a vet treatment that you feel it's very interesting for BNCT research?
Yes, our patients have all been very interesting and very surprising in a way. But perhaps I would choose the case of Lucy, our first dog patient, who was terminal. She was expected to live about a month, and it was expected that she would have to be euthanized. She had a huge nasal carcinoma that reached her brain, and she had a protruding tumor on her nose that was huge and very visible macroscopically, because what was inside you couldn't see. And we treated her, and the result was so impressive in the sense that just a few days after the second application, the tumor was reduced, the visible tumor was reduced almost to a virtually non-visible bump. She was able to start breathing properly again. And that happened so fast, so quickly. It was really impressive. The photos are really impressive. And then she had several months of excellent quality of life. She even went on holidays to the sea with her family and enjoyed the sea. And then she had a relapse. And what was very interesting also is that at 10 months, we retreated her with a full dose of BNCT and saw a very significant clinical benefit. And also, toxicity was milder than after the first application. So that was a very, very interesting finding. Unfortunately, it's one case, but we were very impressed to see that it was as if we had never applied BNCT before in terms of toxicity. So she was very dear to us. And then we had another cat who couldn't breathe, had lost her sight, couldn't eat. And that cat I took care of at home. And it was, I think, one of the most wonderful moments in my scientific life was that 2 days after BNCT, she started breathing and purring. You know how cats purr? And well, she just cuddled up to me and purred. And well, those are moments I will never forget.
From the scientific point of view, what do you feel is the importance of veterinary studies?
Well, basically, I think that veterinary studies are important from 2 points of view. One is obviously the input for clinical studies in humans. That is, of course, a very interesting aspect, and they provide information that experimental models can't provide. These are spontaneous tumors, which are very different in terms of complexity to tumors in experimental models. So they are much, results are easier to extrapolate to a clinical scenario. Body size also mimics what happens in humans much better in terms of treatment planning and dosimetry, toxicity. All those aspects are closer to a clinical scenario. And I also think that they are very important in terms of establishing a role for BNCT in veterinary medicine itself, in and of itself, not only as a bridge towards clinical studies in humans.
As you already mentioned, the research on animal and human patients is very connected. How big is the contribution of the veterinary clinical trials in the development of a human patient treatment?
Well, there is a concept now that is one world, one health, one medicine. And that is a very strong, more recent concept that is very present in different research collaborations. In fact, I found out that in 2013, the Japan Medical Association set up an agreement with the Japan Veterinary Medicine Association to work together academically. And this, I think, is extremely important because there is mutual feedback from one to the other. And I think that is very important. Again, there is so many aspects in common between animals and humans, especially large animals. And in that sense, the collaboration, which, for example, in Japan is very strongly supported at this moment by some groups. I think that is very important, and it's a concept that is not present in all countries, especially the fact that veterinary studies are important in themselves.
At the beginning of March, the Vet BNCT Promotion Project held a symposium titled Towards Expanding the Indications for BNCT in the Veterinary Field, Issues to be Addressed and the Possibility of Interdisciplinary Research. It seems like an interesting step to further Vet BNCT. What do you think about it?
It's an extremely interesting project. I was very privileged to be invited to talk at this symposium. I missed a lot of it because it was a local meeting and it was all in Japanese. So unfortunately, the actual presentations I did not understand, but I did, of course, read the abstracts in English. And I listened to all the presentations. It was strange because for me, it was from 9 in the evening to 6 in the morning. And my dog helped me keep awake. But some of the slides were in English. And well, it was very impressive. The actual project is very impressive. It is moving towards BNCT for veterinary patients. In terms of the actual presentations, they were on work that is being done that will contribute to BNCT in veterinary patients, but it was not actually on BNCT. The only presentation on BNCT itself for dogs and cats was our presentation, which of course was in English. And the other presentations were wonderful, and they involved a huge amount of patients, but treated with other therapies, not with BNCT, or presenting studies on imaging and those sort of studies, but not actual BNCT. Now, the project led by Professor Minoru Suzuki is aimed at BNCT for veterinary patients, and it's a wonderful project, moving in that direction.
What would you suggest to a young student that wants to be involved in radiobiology, maybe in animal patients, but I guess mostly in animal models? What would you suggest to a student?
Yeah, I think that's an excellent question. And young future scientists sometimes don't realize what is involved in this type of work. Of course, there are cell culture studies that are valuable and useful to study the radiobiology of BNCT or radiobiology in general. But I really think that in vivo studies are essential. And in that sense, experimental models and veterinary patients imply handling animals. And I think it's very important for young students to have access ad honorem to labs where this type of studies are occurring, and they should see if they feel comfortable working with animals, because the work with experimental animals is not easy in the sense of, feeling wise. You have to be very convinced that this is worthwhile. It warrants using animals for this purpose. We, of course, are very careful. We don't make them suffer, but we do have to euthanize many animals. And you have to be very sure that you understand why you're doing it, that these studies have to be done for clinical application to be available at some point. I mean, you can't test new therapies on people. And so this is essential and necessary, but not everybody can go through it. I remember I started working with newborn rats, and I got pregnant. I was pregnant at the time, I was young, and I found it very difficult to take these baby rats away from their mom and use them for experiments. I knew why I was doing it, and I hoped that it would make a contribution to medicine. But I think that is something that young people should look into themselves and see how they feel about it. All the rest they can learn. That isn't a problem. It's not that they have to know radiobiology or know anything in particular. They can learn all that. They have to be sure that that is what they want to do.
Thank you very much. I think this is a very important point.